So palliative care is often considered in patients who have serious illness and have had that serious illness for quite some time. Now that illness might be cancer, it might be heart failure, might be lung disease, but they've often been struggling at home with symptoms of shortness of breath, of pain, and their families have been struggling with them, managing those symptoms.
I developed congestive heart failure 10 years ago, and it became progressively worse. As I went along, I had chest pains almost constantly. The breathing was real hard. My doctor talked to me after my last ER visit, and he said that there are things you can do that will make it easier, make your life easier. And he suggested palliative care, and I said, I don't need hospice. He said, this is not hospice. This is palliative care. They understand what you're doing, what's happening to you, and there are teams that can help you and listen to you.
So often they reach a point as a family where they start to say, what's really important to me is that I be comfortable, that my symptoms be managed, and I want to talk with someone who's a specialist in that, talk with a group of people who can help me and my family with my symptoms. So that's often what brings them to palliative care.
Well, before this process of palliative care began, we didn't have a plan. I would just go in and take care of my mom on a day-to-day basis. I really didn't know what I was doing. It was more on maintenance mode. I kept hoping that she was going to get better, but then I realized she really wasn't.
There's sometimes a sense of relief that they've reached that point. There's sometimes a sense of frustration, a sense of loss, as they reflect on what they were able to do in the past and they can't do now. But I think it's important that families and patients really sit and talk about these types of things, talk about where that person is honestly, so that everybody's on the same page. Because I feel when they do that, they often realize that that patient understands very much where they are. They see what's happening to themselves, and they see what's best for them. But oftentimes they're trying to protect their family.
She has a great palliative care team working with her and with the family right now. You know, some of those decisions we thought were really going to be hard when mom progresses and is not able to make decisions for herself have become easier as the team works with us and helps us to take a look at step by step what sort of plan we have to have in place for mom.
A key to both palliative care and hospice is the interdisciplinary team. So we know that patients who are struggling with serious illness struggle with a lot of concerns. And then they often have nursing issues. They may have wounds, they may need help with bathing. And no one provider can do all of that. So really how these disciplines, palliative care and hospice, are provided are through a team. We meet frequently, at a minimum of once a week, but often several times a week, to discuss each patient and to discuss their spiritual concerns, their psychological concerns, their medical concerns, and to really come up with a treatment plan that's appropriate for that patient with the family's involvement. We don't just treat a patient, we treat a patient and a family, because we know that we can't ever treat a person in isolation. It's that entire family group that's important.
So the team is really helping the family work together and have these open conversations so that we can all come to consensus on what the plan needs to be to give the best care for mom.
Palliative care being the aggressive management of patient symptoms. They often feel a sense of relief. So coming to a place and to a person who says, tell me about you, tell me what you've been experiencing and what I can do to support you the best, that's often a bit of a relief when patients reach that point.
These people know my situation, they know the kind of person I am, and they're always coming in and chit-chatting and talking to me and giving me my meds on time. And that's why I feel better. There are no sudden episodes now. I'm short of breath. I know that there are certain things I can't do, so I don't do them.
When a person comes on to palliative care, it often is a very different approach to care than they're used to. When we come into the room to meet with a patient, our main focus is that patient and their perception of what's going on. So their perception of their pain, their perception of their anxiety, their perception of family struggles. I don't so much worry that your blood work is funny. I worry, are you having pain or muscle cramps? Is there something that I can treat? So that's a very different approach, and it sometimes surprises patients that it's all about them and what they're feeling. and their family, because we never treat the patient in isolation.
So we had never heard about palliative care, but it is a great option, especially for someone like my mom with dementia who requires long-term care. This has given her an opportunity to live her best life, have people pay attention to what her wishes are. Now I have people coming up to me asking me about palliative care, and I'm more than happy to spread the word. I'm surprised how many people don't know about it and what a perfect option it is for those that are caregiving others that require long-term care.
Once you weigh the pros and cons, there's no question that this is a much better avenue to pursue. And that's what I would tell someone. It's the best alternative.